Hello everyone. Coronavirus True Life Stories from CTCA UK. My name is Ayşe Osman. Today our story is based on Ersu Ekrem's intensive care trauma. Ersu Bey had a flu symptom just before the lockdown, when the British government decided for the schools and businesses to go to lockdown. Ersu Bey already suffering with some flu symptoms. On the 21st of March, when it was all decided for the businesses to close and for everyone to go home, Ersu Bey has done exactly the same. Ersu Bey closed his shop on the 23rd of March. He was feeling very poorly. He got into his car to go home, and we'll hear everything that happened on that day with his symptoms. I have great pleasure in introducing Ersu Ekrem Bey here to you and his son Ekrem. Ersu Bey, hello, how are you?
Hello, thank you very much. I'm quite well now.
Yes.
Getting over the coronavirus that I've suffered through, and hopefully it'll get better soon.
I must admit, you look a lot better. Every time I see you, there's a big improvement, even in your face, your skin. I'm so happy to see that you're looking really well.
Thank you very much.
Ekrem, thank you very much for joining us. How are you?
I'm all right. Thanks for having me. Really appreciate covering this story. I think it's really important that people know.
Yes, I think so. Thank you very much. Ersu Bey, you got into your car to go home. How was your symptoms?
Well, at first I started having a bit of temperature. I closed my shop early on the 23rd of March. I got in my car, but as I was driving through, I was feeling very poorly. And I had a bit of cough, but not much that I was worried about it. I came home, but because I wasn't feeling well, I more or less went upstairs and locked myself into my room. And then gradually it got worse. My temperature got worse, and my coughing got worse. My sons were, both of them, Ekrem and my younger son, both of them, they were worried about me. They kept dialing, I think, 111 and asking for help. I mean, I can pass on the rest of the story to them because I was feeling rather poorly myself.
But you were conscious.
I was conscious.
You were all right.
Yes, I was conscious of what was going on around me. Even when the ambulance arrived, I was conscious of what was happening. But I'll pass on the message as to what happened with the 111 calls. And the ambulances were very reluctant to actually come to our house and have a look at me first, I believe.
Yes. Okay, Graham. That was a very dangerous time, as well as I don't know, people didn't know what was happening. Hospitals didn't answer, doctors didn't respond to you. How did you manage to get through to hospital for an ambulance?
So, I mean, when the symptoms started showing, first of all, with my dad, we knew the virus was going around, but we didn't, we hoped, let's say, that it wasn't a virus.
Yes.
Because it was only mild symptoms, we hoped it was just a normal cold. But within a few days, it got a lot worse. His breathing was getting heavier and heavier. We could hear him fighting for his breath in the other room. We knew something wasn't right. We phoned 111 multiple times. They eventually did prescribe my dad some antibiotics. But that didn't really work.
So how many days later did he have the antibiotics?
I think it was a few days after you closed down the shop, I think it was, that they prescribed antibiotics. But I think
on the 25th of March, I got the antibiotics.
Yeah. And I think the day after or 2 days after, we called 111 again.
Yes.
I remember I was staying up at night reading up what his symptoms were. And I read a few things, obviously, because the coronavirus was still new. The symptoms weren't very public.
No.
It wasn't very not much information on it. But I did find that he might have been suffering from something called a septic shock, which is what people with diabetes suffer. But whatever it was, I knew I had to call.
It was different kind of flu, wasn't it?
Yeah, completely different.
Yes.
So I made contact with 111. This was about 1 or 2 o'clock in the morning. I went downstairs, woke up my mum. I said, look, we need to get my dad an ambulance.
Yes.
So this was about 1 or 2 o'clock in the morning. I called 111. About 5 or 6 hours later, I managed to get through to somebody on 111 who was a doctor.
Yes.
And after speaking to them, they said this man needs an ambulance. So early hours in the morning, we called 999. Said, look, we need an ambulance, and sort of like demanded we need an ambulance. So it's either that or we bring him to the hospital.
You're going to take him to yourself.
Yeah.
Yes.
So they didn't want that, so they said, all right, we'll send an ambulance. They sent an ambulance out, and they took his oxygen levels as well. And then after some tests, they gathered that he needs to go to the hospital.
Yes.
So we sort of packed his phone, his bits and bobs, and they took him.
Did they give him oxygen straight away?
Not straight away, no. I'm not sure if they give you any oxygen in the ambulance, but
not in the ambulance, and not when we got to the hospital either. They were mostly concerned about taking blood tests and checking out what everything
was wrong with you.
Yes, oxygen was given to me quite later on, when I was admitted to the wards.
The ITU.
Yes, well, when I was admitted into the wards, then they started giving me some oxygen then.
Yes. So obviously they were taking your blood test and whatever, but you were aware what was going on around you.
Yes, I was. I mean, I was aware even when the ambulance came around 5 o'clock in the afternoon to collect me. There was 2 ladies that came in, measured my temperature, counted my breathing. I think they actually asked you to do that as well beforehand, before they could actually dispatch the ambulance.
So basically, before when you were first given the antibiotics, they said normal breathing rate should be between 12 and 19 breaths per minute. And so that night, my dad got really bad. The night before we called the ambulance, his breathing got up to 40 a night.
Yes.
So he definitely needed some help that night. So.
Yes. Okay, so what happened after your dad was taken to hospital? Obviously, you weren't allowed to go with him because they wouldn't let you go into the hospital because of coronavirus. I mean, how did you feel as he left with the ambulance? Or your mother? I mean, you must have been panicked.
Yeah, we all felt like our hands were tied. We were all sort of stuck at home, unable to make proper contact.
Yes.
Like I said, we sort of thought ahead a little bit and passed my dad his phone and his phone charging because we didn't know what hospital he might end up in.
I see.
So it might have been Middlesex, which was the nearest one to us. Yes. But it could have been any other one.
That's
as well.
right.
So just to be on the safe side, he did have his phone with him, luckily. But yeah, it was very hard to make. So the hardest part about it was when he actually got to Middlesex Hospital, we got most of the information directly from my dad. We didn't get too much information from the hospital, but luckily, my dad did.
Luckily, you were contacting your family.
Yes.
That's right.
On a regular basis, more or less.
Yeah, with video call, with phone call, with message, where we could. And we'd arranged to take things down to my dad so we can have something to eat in hospital.
Okay, that was good.
Yeah, we wouldn't be able to see him face to face.
No.
So we'd arrange with a nurse, for example, and the nurse would come down, pick it up from us, and take it up to my dad.
Take it up to him.
But what happened is...
I kept asking for watermelon.
Yeah.
Yes.
So what happened one day was...
You must have been thirsty.
Yes.
Yes.
I asked for some water.
Because he was on IV, weren't you?
Yes.
He was on IV, so he got all his vitamins through the vein, so he didn't need any food. But he still sort of craved something to eat.
Yes.
Being my dad, when he asks for it, we bring it to him. So, and then so one day what happened was...
so that was the second day when you took him something sweet.
It was a few days in.
Okay.
So they eventually gave him the mask.
All right.
And then they put him on IV and everything as well. And that's when we started taking food down to him.
Yes.
Yeah. And one day we got a phone call from Middlesex. And they said that they were going to transfer him to another ward. One that needs less care.
Yes.
Not as much care. Still quite intensive, but not as much. He said, all right, we're going to bring some food down, etc., etc. They said, yeah, just give us a phone call when you're outside. So we showed up the next morning, phoned the new ward he was supposed to be in, and we got a phone call. They answered, sorry, and they said, he's not here. I said, what do you mean he's not here? He's like, well, he could be in the other ward. So we tried calling the other ward. This was all in front of the hospital with the food in our hands. So we tried phoning the original ward he was in. No answer.
So between the two wards, there was no communication whatsoever.
Yeah. And I made about 50 phone calls that day.
Yes.
And there was no answer from the hospital. We didn't know what was happening. My dad stopped answering his phones. He stopped messaging, not messaging back. The hospital was not talking. And it started turning into days where we weren't getting any answers.
Yes.
So the next day, about 50 phone calls a day. And that was just me. My brother was also doing the same thing. And I spent about £70 on my phone bill for that 1 week.
It must have been very frustrating and worrying for all of you.
We visited the hospital again when we were supposed to be at home.
Yes.
We visited the hospital again just because we exhausted every phone line Middlesex had. No one was answering. Went down to the hospital. They sent us back home. You can't be here. Sent us back home again. And eventually, after 4 days, we managed to get through to the hospital. And they said that they had put my dad in an induced coma and put him onto an intubation, which is basically when 5 or 6 doctors put him to sleep, put a tube down your throat, and then everybody flips you over. That's why you need 5 or 6 people. Okay. So it's quite a big thing.
It is, yes.
It's surprising that they didn't tell us that.
Yeah, but I mean, I'm quite surprised they've done all that for him and they didn't know where he was.
Yeah.
It's there was no registration anywhere between the two wards from A to B, how you were transferred, what they were going to do to you. You know, they were, entitled to give you information, obviously.
They didn't really. So when we finally got through to them, they really didn't have an excuse for it. They said sorry. I
think it was the doctor that phoned you and gave you the telephone number as well.
Yeah, so the doctor, because I've got a friend that works in the hospital as well, a few other friends which have helped try and make contact.
Yes.
So they also helped out as well. So when we finally reached the hospital, they knew of us because of the complaints, because of us trying to desperately reach them. They said, sorry, look, my name is Dr. So-and-so. Here's my personal phone number.
Yes.
His own personal phone number for any more information.
That was very nice of him.
So, which was nice, which was definitely good.
Yes. So there was almost 4 days
where I disappeared.
That you disappeared in Middlesex Hospital. Yeah. Yes, ladies and gentlemen, unfortunately, due to lots of people taken ill, with the pandemic, hospitals were inundated with patients. There was not enough doctors, not enough nurses, nobody knew what was happening, and Ersu Bey's family was very frustrated at home and worried about his case. And then what happened afterwards?
He was eventually transferred to UCLH Hospital.
Okay.
So we got a phone call one day.
Do you know why he was transferred to UCL?
The exact reasons aren't very clear. But when we got the phone call from Middlesex, they said, look, we're thinking of transferring your dad to UCLH Hospital. They said it was due to lack of space. But there could have been other reasons for it, I'm not too sure. So they said that they wanted our thoughts on the matter, if we were happy with him transferring. We said, yeah, that's fine. They said they also have to ask my father as well.
Yes.
So what they did is they lightened his sedation.
Sedation.
So he's just about able to give an answer, where he did so by squeezing the doctor's finger to say, yes, I'm happy to go to UCLH.
Can I just, Ersu Bey, while you were being transferred to the other hospital, did you know what was happening around you?
No, and I can't remember actually being asked to give my permission with regards to squeezing their hand.
Yes.
But although it's very difficult to believe, I have got a strong belief that when I first gone to Middlesex Hospital, after a couple of days, they had given up on me, and they had transferred me to a ward that people are not well looked after, as they said. They need
see.
less attention.
Yes.
I think they had given up on me because of my age and my diabetes and all that, and then I was actually left to die. But with my sons complaining and with their friends complaining, they had sort of turned around, and then they said they'll be sending me to another hospital,
Okay.
which is UCLH.
They panicked.
I think they panicked.
Yes.
That is my belief. I might be wrong, but I have a strong sense that this is what has happened. And I was transferred to a better hospital with regards to the coronavirus sort of coronavirus is looking after and medications and things like that. That's what I believe. And it was a good thing that I was transferred because I'm very happy with what has prescribed
at the hospital.
At the other hospital.
Yes.
That's correct. Yeah.
Yes. So you did they transfer him to intensive care straight away? Because yes, they did.
They transferred him straight
And they
away.
were giving you reports daily or?
UCLH was a blessing. So
Yes.
Middlesex, they told us he was going to be transferred, but it wasn't quite clear when he was actually going to be sent off. They were looking for a slot, so they said they'd let us know. And one evening, I've got a phone call, but this time from UCLH. And they said, just to let you know, your dad's arrived. He's here, he's safe.
Yes.
We're going to conduct our own tests and see what the best treatment for him would be based on the tests they're doing.
Yes.
So yeah, every day they called us. Never skipped a beat. Sometimes they'd call us twice a day.
Yes.
If his condition changed, once they called us at like 11:30, 10 o'clock at night, just to let us know his condition slightly changed.
Yes.
Amazing work from the hospital.
So what was the atmosphere like at home between your mom and yourself and your brother? It must have been very difficult.
It was very difficult.
It's how did your mom cope?
So we all sort of leaned on each other at times. So, but we were all strong because we were all hopeful. My dad was always the last person to get sick in the house.
Yes.
And we all know he's a fighter. So we had our hopes up.
Yes.
We did have our hopes up that he would eventually get better. But we had ups and downs.
I'm sorry to hear that, what you went through, actually. I mean, it's enough to, I don't know, to shout, scream, you're at home, you're locked away, you can't go out, you can't visit, you can't do anything.
Felt so powerless.
Yes, you do feel powerless.
Completely powerless.
Yes. Yes.
I mean, I'll tell you one thing. I'm not a religious person, but it's the first time in my life I prayed.
Yes.
It's the first time.
I can imagine.
Yeah.
Yes.
Very difficult.
Okay, so you were in intensive care, and how long were you in intensive care, Ersu Bey?
I think at UCLH 20 days or something.
20 days.
Yes.
Yes.
And when they woke me up for a while, and then they put me back to sleep again, I believe, and then they had to carry out a trachea to me because they said I was actually chewing on the tube that was going down. So they put me to sleep again, and then after a few more days they woke me up, and I remember trying to talk to them because one of the nurses arranged a visual contact, but I couldn't talk.
You didn't have the energy.
Well, I was trying to cough at the same time as well.
Okay.
And they had some kind of vacuum that they were actually clearing my throat. They were switching off the conversation, turning it off, clearing my mouth. I still couldn't talk. I said, I tried to ask them to actually bring me something to write on. Maybe I can tell. I couldn't even write. My strength was not there.
You had no strength at all.
No strength there as well.
Yes.
And I was frustrated, and obviously they were worried as well. But the doctors, I believe, they kept saying, "Oh, you'll get better. You'll get better.
Yes.
Don't worry."
Yes.
And I thought I said, did they wake? I was thinking, did they actually wake me up to
Or were
talk
you
to them
dreaming?
because because I am on the deathbed, and last few days they want me to contact my family. That was the
Okay.
thought that was going through my head at
Yes.
the time when they woke me up to actually speak to them, because I did not have the energy to speak to them, and not the means at the time. That's one of the things. But the other illusion that you've just mentioned is
Yes.
something else that I thought was real at the time. It was an illusion, I think, that I
Yes.
saw. That I've got a small plot of
That was hallucination, isn't it?
Yeah.
hallucination.
Which is I mean, I believe it happens. Heavy drugs, I believe,
sedation.
or muscular degeneration
No, I think
within
it's
the
just
body.
Seduction,
The
sedation.
sedation,
That
yeah,
causes it,
heaviness
yes.
of the drugs and so on.
Yes.
Yes.
At the time, it was very real for me, which, as I try to explain it, I bought a small piece of ground where I hope to be buried if I die.
Like all the Turks do,
Yes, near my
Yes,
dad's
yes.
grave and all that. So I saw that grave being readied, dug up. The soil was there, and some people that I could not recognize, they were beckoning me on. They said, "Come on, come on,
Yes.
you're dead. You have to lie in that." And I was just about to go. I thought, and then I saw my dad putting one leg over one side of the grave and the other leg on the other side, and hushing them away. He said, "No, no, no, it's not his time. Don't hurry him up, and this is not his time," and pushed everybody away.
Yes.
And that was very real for me. And when I woke up, I said, "Am I dead? What is happening?" I couldn't actually figure it out at the time.
Yes. How did you feel when they came out from the heavy medication? When you came to yourself in the ward, how did you feel? Because you were at home 1 minute, then you were at North Middlesex Hospital, then you were at another hospital, and you didn't know what had happened to you for a number of days.
When I just came out of the intensive care, I didn't know which hospital I was in, as you say, but I was not in a state where I could actually communicate properly. I spent a couple of days there in the ICU. They transferred me over to another ward. I was getting a little bit better.
Yes.
But this was again like intensive care, where the nurses were taking all the precautions,
Yes.
very severe precautions. That's where I made the other program with the BBC in that ward. And they were trying to give me physiotherapy where I had to raise my hands and try to sit me down, stand me
Yes.
up. Pardon me. But in that ward, they told me that I was at UCLH. That's where I more or less
Yes.
learned that I was at UCLH. I stayed in that ward for a little while. Then they transferred me over to another ward where the coronavirus sufferers were actually progressing through.
Yes.
And I was more in myself and more able to communicate in that
Yes.
ward. In that
Yes.
ward.
Well, ladies and gentlemen, BBC News World was visiting hospitals for people in intensive care. That was the first week in April, wasn't it? I think. Going around and seeing how people were fighting with the coronavirus, what were happening to them. On this occasion, there was a reporter. He did speak to a gentleman, and then the next one was Ersu Ekrem in the hospital, and this was shown all over England, the world. And obviously, not having seen anything like this at all, we were all shocked. I mean, I was shocked to see what was happening in hospitals, what kind of damage coronavirus was causing to people. It was very scary. Everyone was locked at home. Nobody was allowed to go out or shopping. The food shopping was made by deliveries to home. People were only going out for fresh air. to exercise. Some of us had gardens. Obviously, with gardens, we had the advantage of going out to our gardens. And luckily, we did have nice weather then, didn't we? It was nice and sunny. But for people who lived in apartments, flats, it must have been very, very difficult. I can understand what the family has gone through. So I'm going to turn to Ekrem now. Can you carry on telling us what happened? Did you see that reporter's recording on the news on BBC?
Yeah. So my dad did make us aware that he was going to be on TV. In a sense, he was probably more active than we were being in hospital. So. But yeah, we did see it on TV.
Yes.
Sent it to family members and
That's
translated it for the family as well, as you can imagine. But yeah.
He's done the Turkish translation on that one and spread it around.
Yes. We're having a small break now and we'll carry on from where we left off. Ersu Bey, so on the 30th of April, they taken off the ventilators.
Yes.
And on the 24th of obviously April, your wife tried to speak to you. You spoke to your wife on the telephone and you were getting better day by day.
On the 24th, I could not manage to speak.
Okay.
But on the 28th,
you managed.
Yes, I managed to they managed to understand a little bit of what I was trying to say.
Yes, you were confused.
Yes, I was a bit confused at first. In the first conversation that we had, my wife was trying to tell me that everything was getting better.
Yes.
But as I explained before, I thought that they had actually woken me up a little bit to speak and say goodbye to my family because
I see.
they were giving up on
Yes.
me. That was the thought that was going through my mind.
He kept saying no and we were telling you that you're getting better.
Yes, I kept saying
he
no.
didn't accept that he was getting better.
Yes, because that was the thought that was going through my mind at the time. And afterwards, in the second one, sort of, I said, okay, I'm not dead still.
Yes.
So maybe I'm getting better.
Yes.
But that was the thoughts that I was passing through my mind.
And that changed your outlook.
Yes.
You know, the way you looked at the world differently.
Of course. I said, I've got to fight back now. And, and then try and, do as much as I can to get
help
better.
Yourself to get better.
Yes. I had not given up on myself. So I started to fight back.
Oh, that was excellent. Yes, that was a very positive mood. And they changed your ward on the 4th of May. And you also had tracheostomy, which is in your throat. And they've taken that out.
On the 4th.
On the 4th, they managed to sit you up.
That's correct, yes.
And then following that, they changed your ward to recovery.
That's correct.
Also intensive care but recovery section. And physiotherapy.
Physiotherapy in the same hospital, but not in the intensive care as such. It was not counted as intensive care. It was regarded as a ward that people recovering from coronavirus were put to.
Yes.
In the not the sleeping stage, not the intensive care, but the next stage up.
Yes.
And there the physiotherapy was more started on the physiotherapy with me, and they were trying to get me to sit up and do other things, stand up.
Yes.
And they were very good. I was very happy with them. There was a Turkish nurse there as well, which I liked because I thought, well, there's somebody doing something from our community to try and help these COVID victims. I was, quite pleased with that as well.
That pleased you to see somebody from your homeland.
That's correct. Yes.
In the hospital. Obviously, it was a shock to your system. How did you feel when you first set up? Where you managed to use your arm, your leg? What happened afterwards?
I could use my arms, but my legs, I felt terrible pain all the time, and they carried out some tests, and they said that I had blockages, four blockages. I thought, why are they not doing something for that? I asked, I said, can I have some kind of either massage or something? They said, we do not want to remove these blockages by massaging them because they can get displaced and go somewhere that we cannot control them.
I see.
In your legs, we can control them. They started giving me some injections to actually thin the blood.
The blood, yes.
And then dissolve those clots, as they say. But
was it painful? Did you, I mean...
The injections were not that painful. They were usually in my stomach. Every day I used to have an injection to thin the blood. But I could still get a lot of pains in my legs and I could not
What was it like, pins
legs.
on needles or heaviness?
Pins and needles mostly. And then even a touching of the sheet, bed sheet on my feet would actually be painful. So
I used to say it was like burning as well.
Yes, burning sensation. It was as if somebody had poured petrol over your skin and light it up. It was that painful sometimes.
Really?
Yes. They started giving me some kind of medicine for that as well, and gradually increased it to the maximum amount.
Yes.
And that's the frequency of those terrible pains. They were like electric shocks. They were so intense and so frequent that I couldn't sleep properly and things like that. And as they increased the medicine, then the frequency decreased and I could relax a little bit more and I could concentrate on trying to use my legs and trying to stand up or other things. I didn't have much problem with my arms, just my legs, and especially my right leg. But then I found out it was not the leg, but it was actually the feet that was causing the problem. And it was nervous.
It hit
the nerves.
Yes.
Nerve system. I actually found out that on the very rare occasions the coronavirus had attacked my nervous system. They were not very sure if it was my nervous system that the coronavirus attacked or something on my neck that was squeezing the nerves.
I see.
So they were in two minds. I had done some MRIs and they said, maybe it is from your neck. But I explained to them that I never had any problems before. And it's not something that can actually happen overnight. One day you're okay, you're walking 8,000 steps a day, and the next day you cannot walk because of the trapped nerve or whatever it is.
Yes.
Because I didn't do any exerted exercises or anything like that. So they said maybe 50-50.
They weren't sure, they didn't know.
They didn't know as well. But I was pretty sure that even if it was from my neck, it was the way they had laid me when I was incubated in the intensive care, because I believe that they had to lay me down on my front.
I see.
And most probably because of those tubes that were going in, they were bending my head back too much or whatever.
And it hurt your nerve system.
That's what I thought was connected with that. And not the coronavirus, as they explained. But later on, they found out that it could have been the coronavirus attacking my nervous system as well, which on very rare occasions, it does happen. And this was the case with me, and they started carrying out more tests with me, even, doctors doing some kind of research on me and writing up on it as well.
Yes. So, ladies and gentlemen, coronavirus symptoms, it was so strong, even today they don't know how it happens. It affects your nervous system, your kidneys, your blood. There is no solution just yet. We don't know what will happen. There's so many people in hospitals suffering from the virus. It is very interesting for Ersu Bey to tell us his symptoms, what happened with him in the hospital. And obviously, I hope this will help you out there, you will protect yourselves. It is not a joke listening to Ersu Bey. It is absolutely serious. Coming back to you, Ersu Bey, physiotherapies happened on a daily basis.
Daily basis, even sometimes twice a day. And as I explained before, I started fighting back. And if they were telling me to do a 10-minute exercise, I would do 15 minutes.
Yes.
I'll push myself to the limit to try and get better quicker.
Yes.
Because obviously
you
I was missing my family, get better soon. I was missing my family. But one message I would like to give, as you was just saying to the audience, that they should be looking after themselves and taking this illness very seriously. I do not wish this on my enemies, what I went through. And please take it seriously and take all the precautions not to get caught to this disease. That's the message that I would like to give to all the people out there.
Yes, thank you very much. Yes, the lockdown eased off. People have gone to work. But many of them are still frightened. Almost everyone is frightened to use the public transport to go to their works, and they're working from home. Trains and buses, they're empty at the moment, but people are using their cars. Too much traffic on the roads, I must admit. We have to look after ourselves, protect ourselves, wear protection when we're in crowded places. To our surprise, easing off people started going to celebrations, birthday celebrations, anniversaries, started coming out, meeting with their loved ones after not seeing one another for almost 3 months. This week gone, schools have opened. There's big panic with children and families. If one child is suffering with any kind of symptoms in a school, the whole classroom will have to stay home, and there is a whole classroom and all their families as well. So we are treading on very dangerous grounds at the moment. We have to look after ourselves. The vaccination is not confirmed. It's all over the world. All the countries are trying to find a vaccination, but it is not definite. Some are saying it will be sometime next year. Some are saying it will be earlier. We don't know until a tested vaccination is found. What we're finding in England at the moment, all the GPs, local surgeries, they are having virus tests. So if anyone did suffer with coronavirus symptoms, they can go and have themselves tested, so they will know if they did have coronavirus. Approaching winter, also the vaccinations will start from the second week in September. Elderly over 50, 60 years old, they must go and have their flu injections done if they do believe in it. Do try and take some supplementary vitamin tablets, but if you are under any medication at all, you must speak to your GP, get tested before taking supplementary vitamins. Another thing, as the lockdown has eased and we're all out and about, coming out from our homes, obviously we need fresh air, and we're all wearing masks. People who cannot wear a mask due to health reasons, they should get an exempt certificate from their doctors. So if they're stopped by police or anybody else, they need to provide this medical certificate. Otherwise, the fines at the moment are between £1,000 and £3,200 in England. This came into effect from the 14th of August. So please take care of yourselves. It is not a joke that, lots of people have suffered. We want to get better. We want to go forward. We don't want to go into lockdown again, but we don't know what will happen, what symptoms we will suffer with the winter flus. Ekrem, is there anything else you would like to add to our audience?
I'll build upon basically the warning to everybody, because I work in retail, and I get a surprising amount of people coming in and telling me that the virus doesn't exist,
Yes,
and that it's a hoax. And that's a very difficult thing to hear, especially with my father and us going through everything that we
Yes.
did. To hear that what we went through does not exist is pathetic.
Yes.
People need to start taking this seriously. Even if you don't believe in it, do what you have to do by protecting yourself.
Yes.
And protecting those who do believe in it, at least. But yeah, that's all I have to say.
Yes. I must admit, we did lose a lot of people, elderly, over 60s, who had health reasons in the care homes and in hospitals where they weren't looked after properly, where they didn't have enough protection cover. Amazingly, from April to today, we hardly lost any lives to coronavirus, which is a good thing. And, we hope we'll carry on like this, so no families wants to suffer with a lost one, actually. Ersu Bey, is there anything else you would like to add to our conversation?
Yes, the message we've given before stands still, that we have to look after ourselves as well as others by wearing the masks. A lot of people are thinking that once the vaccination comes about, everything will be all right. We've got to actually think of this virus as it is a virus, like the cold virus. It changes and adapts itself. So we've got to actually be on our guard all the time. Even I believe that I've caught the coronavirus and I might have some antibodies against it and all that, but that will not prevent me from catching this another time after a while, because coronavirus will actually change and adapt itself as well. So please, everybody, take care of themselves as much as they can, even if they've got the coronavirus at some period in the past. They can still catch it again, and this time it may come as a very big, bigger influence on the person itself. So please be careful.
Yes, thank you, Ersu Bey. If you have underlying health issues, you must call 111 straight away. If it's serious, shortness of breath, your burning sensation, face dropping, you must get in contact with your hospital or your GP, and so they can take care of you. Ersu Bey, thank you very much for taking time and coming here for the second time for these discussions. We had one in Turkish and today's in English. Thank you very much. I'm really grateful to you. And there was a big demand. People wanted to hear you talk in English, all your symptoms. So here we are, Ersu Bey and Ekrem. We've gone through his symptoms once again just for you. Ekrem, thank you very much for being with us here today.
My pleasure.
Thank you.
It was a pleasure having you.
Thank you.
Thanks to Duygu Tamaç, Kanal T, my family, my big family behind me, CTCA UK, Management Committee, past chairs, chair, everyone. It has been pleasure talking with you and Ersu Bey and everybody else who did come to our program. These programs will carry on until I see you next time. Please take care of yourselves, do wear your protections, and keep well. Thank you for watching.